Good healthcare in pregnancy is vital for the health of you and your unborn baby. You can get the healthcare you need by visiting a midwife or other trained health professional for antenatal care during your pregnancy. This care is known as Focused Antenatal Care or FANC. Medical Aid Films has made this film to explain why it is so important for you to attend FANC appointments and to explain what happens when you attend. Being checked by a health worker can protect you and your unborn baby from life-threatening complications during pregnancy and birth. So if there's one thing you remember from watching this film, it's to please attend all your antenatal appointments. Now it's time to go over to our health professional to find out more.
As soon as you suspect or know that you are pregnant, go to your nearest health facility for a first FANC appointment. The appointment will be done by someone just like me, a FANC midwife or any trained healthcare worker. They are here to support you and your partner throughout your pregnancy. I make sure that antenatal visits are friendly and helpful, and I will provide you both with important health information and help you prepare for birth. They will tell you where you should go to give birth to your baby and what signs and symptoms you should look out for when you are pregnant. They will explain that you should seek medical help straight away if you have a problem. If you are worried or need extra help, then you can get this by going to your health post at any time. Try to bring your partner with you if you can. If they aren't available, then a family member or a close friend will do. This is important because there will be a lot to think and talk about. It is good for somebody to be there to support you. Every woman is different, and so the care that you need can only be decided through talking and monitoring you during your FANC visits. Most women will only need to come and see their health worker 4 times during pregnancy. But if there are any changes in your condition or your health, then you may need more care during your pregnancy, and they may want to see you more than 4 times. It is important to attend all the appointments you are offered. If they do find any problems, then they can treat this, or they may refer you to see another health worker to help you get the treatment you need to give birth to a healthy baby.
So you already understand more about what Focused Antenatal Care offers. It is important to start going to your appointments early on in your pregnancy.
The reason for this is that some of the advice, help and medicines I will give you in FANC sessions need to be started as soon as possible. If you are anemic or have a sexually transmitted infection, also known as STI, then attending antenatal care means the health worker can give you advice and treatment on how to protect you and your baby during pregnancy and birth. If you are HIV positive, they can give you advice and treatment which can help you and can also prevent your baby being born with HIV. They can also give you 2 tetanus injections, but only if you come along early enough in pregnancy. Many babies die from tetanus soon after they are born, but these injections can prevent your baby developing tetanus and help save its life.
So, we now know to attend FANC as soon as possible. But it is not just about having tests and checkups. FANC also helps you to plan for the birth.
An important part of the care the health worker provides is helping women to prepare for the birth, including planning for any emergencies. They can explain how to recognize the danger signs, such as bleeding, abdominal pain, severe headaches, feeling very tired and weak, or if your baby is not moving normally inside you. They will also teach you how you can look after your health and your baby's health during pregnancy, including which foods you can eat to help you stay strong and help your baby to grow well and be born healthy. They have helped a lot of women in this way.
FANC helped us to plan for the birth, including who would take me to the health center to give birth and who would look after our other children.
Because I attended my FANC visits, the midwife noticed early on that I was very pale. I was anemic, so she gave me medicine to help with this. Without this, my baby could have been born too small or too soon to survive, and I could have been very ill or died if I had any bleeding.
At the antenatal visits, I learned the importance of giving birth with a midwife or other health worker who has been trained and has the skills to help me give birth safely, especially as they will be able to recognize any complications and make sure I get the right treatment.
I learned from my antenatal visits that if I had vaginal bleeding, I should go to the health post immediately. This information saved my life and that of my baby. In my FANC visit, I was tested for HIV. The midwife told me that even if I was found positive, I will be treated so that I may not pass the disease on to my baby. I tested HIV positive when I went for an antenatal visit. They told me that if I had treatment, my baby could be protected from the virus. After he was born, I went to get him tested 3 times because I could not believe it. But he's not infected. I am so happy he's now growing up free from HIV.
FANC is also about giving you health advice and information to keep you in good health during and after your pregnancy. You can watch the math film, What Pregnant Women Should Eat, for more information. We've explained why it's important to bring your partner to the FANC appointments. We asked some partners what they had learned at FANC.
We are hearing together, we can share together questions and any facility service together. So that's very important to us.
The midwife was happy explaining to me why it is important to prepare my wife for the birth. She explained that sometimes complications may occur and then I should get prepared for any emergencies because that will help me to avoid any delays in getting her to the hospital for the right treatment, and this will be good for her and the baby.
The education she gave us meant I knew when my wife had a fever, she had to see the midwife straight away. They told her she had malaria and they were able to treat her quickly. I went with my wife to the FANC. I was embarrassed at the start as there were a lot of women there and not many men. I learned so much and I'm now telling all my friends to go to the meetings.
So now we have a good general idea about what FANC is. Let's find out what actually happens at each visit.
The 4 FANC visits are enough to monitor your progress. It will allow you and your health worker to establish if you need further care. But remember, if you are concerned about anything during your pregnancy, you can and should immediately visit your health worker, even if it is not on any one of your scheduled visits. At the first visit, they will ask you about your health and any other pregnancies or births you have had. It is important to tell them if you have had complications before in pregnancy or giving birth, so they can monitor you for signs of these complications or take action to prevent them. They can teach you to be aware of danger signs as well. They will also estimate the date you will give birth. In each of the second, third, and fourth visits, they will test to make sure you are generally healthy. There are not any complications, and that your baby is growing normally and in the correct position. They can only see this by measuring your belly and recording this in your records. You can also ask your health worker about your baby's movements and ask them to check the baby's heartbeat if you have any concerns. They will also check your blood pressure and explain the signs of dangerously high blood pressure, such as very bad headaches and blurry vision. They will take a urine sample and ask you questions such as, have you had any bleeding? It is very important that you attend all the 4 visits. This is because the medicines that you'll be given there cannot all be taken at once. They need to be taken at different times during your pregnancy. In the last visits, they need to see if the baby is in good position for you to give birth safely, and also to see if you're expecting more than one baby. As well as carrying out these checks, they will always make sure that there is time for you or your partner to ask questions and talk about preparing for the birth. They also give you information on how to plan your family. They explain why it is recommended that you wait 2 years after birth before becoming pregnant again. They tell you about what contraception options are available and where to get them from. The women and their partners are really pleased with the help they receive at FANC.
In my FANC visit, the midwife noticed the baby was in a breech position, fit face, so we were able to make plans to have the baby in a hospital, which I think saved my life and that of my baby.
I felt very tired, dizzy and breathless in my pregnancy. The midwife told me I was anemic, which is caused by not enough iron. She gave me supplements of iron, folic acid and vitamin B12, and after a while my blood was a lot stronger and I felt much better.
So by registering for FANC, as soon as you know you are pregnant, you will be able to be tested and assessed. You will feel secure that the FANC health worker understands your medical history and can anticipate any future complications. All of this will help you to have a safe pregnancy and delivery. Remember that registering for FANC as soon as you know you are pregnant will give you and your baby the best possible start in life. So please don't miss out.